Today I'm talking about urinary tract infections and hormone balance. Hey, thanks so much for being here. I'm Dr. Shelley Meyer. Welcome back to my channel if you're returning, and welcome if it's your first time. Lately, I've been focusing a lot on hormone balance and perimenopause. I've also done tons of videos on gut health, metabolic health, and anything in between all of those topics. So I'm a functional medicine doctor, registered dietitian, and a primary care doctor. So I do this stuff all the time with my patients in my practice, Highlands Health and Wellness in Denver, Colorado. I am here on YouTube to try to share some of that with you to hopefully help you as well. So if you like the idea of that kind of content, please subscribe and please hit the like hit the like button if you like the content so the channel can grow and I can keep making these videos. So today I'm going to talk about something that comes up in my practice a lot, and that's urinary tract infection, especially urinary tract infections for women in the setting of changing hormones, particularly when it's perimenopause and estrogen starts to decline. So when does estrogen start to decline? If you haven't seen any of my recent perimenopause videos on the stages of perimenopause, or if you haven't checked out our blog, perimenopause.help, I highly recommend you do if you're curious about the different stages of perimenopause. So perimenopause are the years leading up to menopause. Menopause officially is just one day. The one day you have gone a year without a period as a woman is menopause. I mean, if you're like the age for it. Sometimes it happens when you're younger, in your teen years or 20s, because of stress or other stressors in our lives from physiological stress too. So it could be that, but when you're older, and you're like older than those ages, not old, but in your mid 40s, late 40s, mid 40s would be a bit early, but late 40s, early 50s or beyond, that's when actual real menopause is normal. It's a normal state that we all go through. I mean, not we all, that women go through. So back to the topic. I was talking about the stages of perimenopause. So stage 2 is kind of the later stage of perimenopause. Perimenopause can last 2 to 8+ years. So you can have a lot of years leading up to that last day when you hit menopause. So in the final years, the last couple, 2, 3, could be longer for some women, you find that your estrogen is declining. And that's when we can see urinary tract infections happen more often. Of course, younger women get urinary tract infections too. It's not isolated to estrogen changes. But in particular in this topic, when women start to have those hormone changes and estrogen starts to decline, we can get urinary tract infections a lot more easily. And why do we get that? The pH is changing in the vaginal microbiome area. Moisture levels are going down because of the loss of estrogen. It's getting more drier. So you don't have that protective barrier that you had before to, stop everything. The most common bacteria for urinary tract infections is E. coli. I know that's gross because it is coming from your backside, from the poop. But it just happens with women where everything's so close together in that area that's the most common cause. So it's not like you're having more of that bacteria when you're in perimenopause, but you have less of the barrier to prevent an actual urinary tract infection. So that's part of it. And then when you get further into menopause, you get even more, unfortunately, more vaginal dryness. And then you're going to have less of that barrier too. You could have some itching, which would introduce more bacteria to the area with your hands. You're probably not skin to skin contact, but you might be sometimes, and that can cause more bacteria. Even you just don't have that barrier there, so even sweating and that kind of thing, you could have more urinary tract infections from the vaginal dryness and the lack of the barrier. So that's kind of why it happens. Now, what can you do about it? Well, first you want to know if it's an actual urinary tract infection. You don't want to rush out and, that in the US, you can't buy an antibiotic over the counter anyway, but I know in some other countries where you might be watching this, you can. So don't rush out and get an antibiotic. Know before you do that, because you don't want to screw up your microbiome. Check out all my gut health videos. You know what can happen if you've seen those or if you've experienced it, if you take antibiotics when you don't need to or too much. So they have their place though. But get a test. So in the US, you can go to your doctor, you can go to an urgent care, you can get a test, but you can also get them at home. At the drugstore now, and take them at home. And of course, we do want you to have a provider, a healthcare provider, to say, okay, my test was positive. What are we going to do about it? But you definitely want to confirm it with a test. So it's just in the office for us, it's just a dipstick test and we can tell. And same thing it is if you buy the one at-home kit. Not the one, but if you buy an at-home kit. So you can test yourself or you can go to the doctor. Now, if it is confirmed that it's urinary tract infection, do you have to have antibiotics? No. Do you sometimes have to have antibiotics? Yes. So antibiotics have their place, like I said, but there's a supplement I use quite often that's cranberry and D-mannose together. And cranberry you may have heard of, that it helps to protect the urinary tract lining, and helps to create a better pH there and less of a condition where bacteria can grow. Take that and you combine it with D-mannose, which is actually a sugar derivative that it's not sugar, but it tastes very sweet if you have it in the powder form. So it's not like cane sugar. It is a sugar derivative, though. That when you combine that with the cranberry, you can really kill off E. coli in particular. It's very effective at killing E. coli. So Solaray is a good brand that you can get on Amazon or and I'll put a link there to that. There's some brands you can get on my supplement dispensary where you can get a discount. I'll put a link in the description to that, which are not Solaray, but other doctor brands. Or you can get Solaray at like health food stores, and there probably are some other brands I'm just not thinking of that have cranberry and D-mannose in them. But that's what you want to look for, is cranberry and D-mannose. So give that a try. Now, if that doesn't work, you don't want to just keep doing it. Like if you have a fever, if you are feeling like it's getting into your kidney, you feel nausea, you feel pain in your back, you're vomiting, like of course, then go look into a antibiotic. But if we can defer that antibiotic and use the cranberry and Solaray and there's Femdophilus is a great probiotic, combine all those together and take care of that UTI, then that's better. But if you don't feel better within 3 to 5 days, or you start to feel worse, any of those symptoms, fever, weakness, mental status is changing, pain in your back, vomiting, nausea, then you want to consider the antibiotic. A lot of times doctors will start with a simpler antibiotic like Macrobid that doesn't hit your system as hard as some of the stronger antibiotics, but you can use things like amoxicillin. You can sometimes use Cipro. We don't use that as much anymore because that's really hard on our body. It's along the same lines as levofloxacin in that same family. Really hard on our joints and our cartilage. So if we can save that, so not use that, that's better. Bactrim can also work, but there are some parts of the US that are resistant to Bactrim because of overuse. And that's might happen with all of our antibiotics eventually. So that's why we want to be very conservative when we consider using antibiotics, not just because they screw up your gut, but because we don't want to run out of them either. But I highly recommend the cranberry and D-mannose. I'll put a link to that in the description down below. I'll put a link to some of those at-home urinary test kits that you can do. And please let me know any questions you have. I can't act as your doctor. I'm not giving you actual medical advice. I know it sounds like I am, but I'm just telling you what I use with my patients. But only your healthcare provider knows you. So always run all of this by your healthcare provider, because maybe the cranberry D-mannose is not a good combo for you. So you want to take everything into consideration, because YouTube is not individual medical advice. So I hope this helps, though. I hope it gives you information. I hope it helps you learn and find solutions that you can explore with your healthcare provider. And I'll see you in the next video.